So what we're going to see is neurological status deteriorates within 10 minutes to 2 hours. So second impact, almost immediate. This progresses 10 minutes to 2 hours. Reason one, not to go to sleep right away. Because I can't assess their cognitive function if they're asleep. And if this is bleeding, they might not wake back up. This is your concern. You may have a skull fracture and something like this, and it can be noted on X-ray. And it will do this to your brain. So the pressure from the bleeding will crush your brain. A massive pool that kind of sits there and has caused pressure on the brain. That's a medical emergency. So what are we doing? You come off the field, you're concussed. Hopefully I've got something that's a baseline test of some sort. I've been able to see how well you can balance when you're normally clean and coherent. I understand that you would remember what breakfast was, that you remember what dinner is, that you remember who you are. And then if I've got these symptoms, if I've got them coming off the field saying I hit my head, I don't feel right, headache, nausea, vomiting, whatever, then you get a baseline. What can they remember? Do they remember the game? Do they remember the score? Do they remember the play? So you've got retroversion, antroversion memory. You've got assessment of do they have memory from before the play? Can they form memories from that play on, from the time of that concussion on? So I want you to remember 3 numbers, okay? 1, 4, and potato. Got it? Yeah, I'm going to ask you that again. 1, 4, and potato. Can you tell me that, please? Excellent. Thank you. Good 3 numbers, right? Okay. And usually, if there's any kind of cognitive coherency within this individual, they're going to have a little snicker. So it's going to give you a hint of personality. But if it's bad enough, and they're like, 1, 4, potato. Okay. And I'll walk back up about a minute later and be like, okay, can you tell me the 3 numbers you said? Excellent. See, and then many times they won't even remember that you told them anything to do. I've had a case where there was one kid that he was standing there, and he was one of our starters, and the team wanted him in, and his little freshman teammate, who I felt like drop kicking at the time, actually stood behind him the entire time, was like, 1, 4, potato, 1, 4, potato, telling him the entire time for 5 minutes. I walk back up, and I hear him doing that. I'm like, seriously? Can you tell me the 3 numbers here? He's like, huh? What? Oh. 1. Huh? And that was all I got. And then that kid started getting pissed because he's like, he started realizing he wasn't playing, everybody else was, and he's like, why am I not in the game? I'm like, dude, because you have a concussion and you're needing to sit out. He's like, no, I'm playing. Where's my helmet? And see, that's the trick. There's 2 ways to go about this. You steal a cleat or you steal a helmet. His helmet was in my truck. Because if you've got access, the ability to remove that, well, you can't play without a helmet. So it kind of helps simplify that process a little bit. It's like, I don't know, what'd you do with it? All right, so what we've got is, we've got this problem. Now, if I'm talking to you and you're responding, then you're hearing my words, you're functioning. If you can see, we've got cranial nerve assessments that go along with all of this. If you're able to verbalize and respond, then you've got all of those pathways, left hemisphere, functioning properly to comprehend, well, hear, comprehend, and create speech. Cognitively and then physically create speech. So there's like 4 major pathways under that kind of help work that. That's a whole lot of this side of the brain. So if we've got a major issue, then, well, we get it. Now, if those symptoms get worse, headaches become a lot worse, speech begins to slur, motor control becomes failing, comprehension, lucidity begins to drop, there's an issue. The concussion's damage is done. So if you're seeing an increase in symptoms, then there's something else going on, and that's not okay. That's your 911 call. You get them to the hospital, you get them to advanced medical care quickly. Subdural hematomas. If acute, presents within 48 to 72 hours. And there's a way to have a chronic version of this, but it's not going to get us too bad. Now this is coming from stretching or damage of the subdural veins. So, arterial bleed, epidural, middle meningeal artery. Subdural veins, subdural hematoma. Slower bleed, doesn't come on as quickly. 48, 72 hours. They're going to have progressive symptoms, but it's going to be slower. It's going to be a longer, worse headache that kind of builds up over time. So we need to continue to assess their cognitive function over the first day, 2 days, keep an eye on them. So what's the rule? The rule I will typically say is that in terms of letting somebody sleep, I'm not worried about the concussion, I'm worried about these bleeds. Secondary problems that would kill them. So I let them go to sleep. Usually you want to keep an eye on them for about the first 2 hours or so to make sure that you can get through that acute, crazy, scary epidural problem. And then beyond that, let them go to sleep. But you wake them up maybe 2-3 times in a night. Every couple hours, every 2, maybe 3 hours, and you just have a conversation with them. Do you remember the numbers I told you? Do you remember your name? What you have for breakfast? Just enough questions. I mean, they're going to be crazy tired, so it's not like you're going to get the best responses. But again, you're looking for slurred speech. You're looking for significant cognitive dysfunction, increasing headaches, that kind of stuff. Certainly cognitive function within the realm of the sleeping individual. And then you get up the next day and you have them kind of chill. So beyond that, no reading, writing, arithmetic. Your brain, your neurons fire whether you're telling your body to exercise or your brain to do calculus. So the idea is that you need to rest. And there's research out there saying that if I can put you in a dark room with no stimulus, you'll heal faster. If I can give you cognitive rest, the symptoms will go away quicker. Which means that you don't get to sit at home all day playing PlayStation. You get to sit at home all day with the lights turned dim and resting. But at the same time, I don't want you doing homework. And that goes into the policies you help write with the institution you're working with, that you support the fact that if you've got a concussion patient, that you have it worked out that there is policy to pull them out of assignments, out of homework, once they give them time to work back in, because they're not going to function well. And the harder you push them cognitively, the longer these symptoms are going to delay. So take care of that individual the right way. Give them the cognitive rest as well as the physical rest.
So if you're pretty sure about it, and I know you can't prescribe anything, but could you tell them to take C4 or something, just make sure they go to sleep or anything like that?
I wouldn't do anything that would encourage sleep. Because again, and we can get into medication concepts, but what are we trying to do is we're trying to assess how they are and how they're doing. And I don't want them being so sleepy that they don't come out of it if there is something else going on. So especially the first day or two, I don't really want to give them much of anything. For the headache, because they're probably going to have one. You've got your pretty much your choice between Tylenol and NSAIDs. And I will say that your choice has to be Tylenol. Without a doubt, it has to be acetaminophen. NSAIDs, as we've discussed somewhat in terms of the clotting cascade and so forth, NSAIDs are blood thinners. Don't want a blood thinner right now. That's not okay. So any aspirin, ibuprofen, and you need to recognize there's something. Anybody here heard of Goody's headache powder? Do you know what's in Goody's headache powder? And nobody does, because that's not what they promote. They promote that it's fast and it works, and it does. It's powdered combination of aspirin and Tylenol. So it's already ground up. You pour it in a drink, you knock it back, so it gets absorbed a whole lot faster. But it is a combination of an NSAID with acetaminophen, which again is why it touts as working so well, because it's hitting it from two different directions. Your body processes acetaminophen differently than NSAIDs. So it's good, but not for this, because for this, it's going to have the blood thinner component of the NSAIDs, which is a problem. And that's what you're going to get. You're going to have a kid at a high school come off the field and say, I have a headache, Mom, can I have some pain meds? And Mom's going to be like, sure, sweetie, or go find somebody in the stands who's got some goodies. And they go hand them the goodies, and you're giving it the blood thinner, which is not what we want to do. Subdural hematoma. bad day.